It is now my privilege to introduce a session about the patient-physician interview. I'm calling on the stage Professor Sahai, who is a medical oncologist at the University of Michigan in Ann Arbor, and Laurie Robertson, who is a patient who received a diagnosis of extrahepatic distal cholangiocarcinoma, and under the guidance of Professor Sahai, had access to a phase 1 clinical trial, which turned out to be quite a good success for her tumor control. Thank you.
Thank you for having us, and I'd like to keep this a little bit informal and just have a discussion between the two of us, if that's okay. We do have a couple of slides, and mostly for engaging you guys in the journey that Laurie went through. And before we start, I just want to thank her for having the courage to come up and share her story. I'm sure this brings back lots of memories that she doesn't want to relive, and I apologize on behalf of both of us, but certainly look forward to you sharing your journey that perhaps even I'm not aware of some of the things you've went through and did not share with me, and hoping you can again go through some of these things for benefiting the patients, caregivers, and the physicians who are in the audience today. So thank you, Laurie.
Thank you. Thank you for having me.
So, I understand that your journey, Laurie, really began in 2018, and I was not part of your care back then, and I understand that you had upper intestinal symptoms, and I'm hoping you can shed some light on what happened, what led you to the hospital, and what really happened next.
Okay. Well, I was otherwise a healthy 52-year-old female, with the exception of high blood pressure, which I inherited from my father, and generalized anxiety. I was working on Thursday, October 4th. You always remember your dates. And I remember complaining about epigastric pain, and I said, I think I might be having a gallbladder attack. And my coworker said, you would know if it's gallbladder. So I finished out the workday, and I woke up on Friday, and I was just sick. I was weak, but ironically, I had a physical scheduled with my internist. I usually go once a year, mostly to renew my maintenance medications. I'm really bad about going to the doctor, except for the physical. When I was a co-op in high school, I started working in the emergency center at a local hospital, and for the better part of 35 years, I've worked with the emergency center. And if you know that type of person, we just don't go to the doctor. So I went to my internist, and she took one look at me and said, you need to go to the emergency center. Well, I already know what that means. I really don't want to do that. But my son had driven me to the appointment because I was very weak. He drove me to my emergency center, and I was seen, had all of the lab tests. Ultrasound did confirm gallstones. So, of course, I got admitted for a simple gallbladder removal. But they did see stones in my common bile duct, so they recommended an MRI to confirm that before the removal. I don't know if you were here yesterday and you listened to Dr. Goldschlack's talk, but he talked about how on the weekend in a hospital nothing happens. And unfortunately, it was the weekend. So Saturday and Sunday, I felt totally fine. I was just waiting to have this gallbladder removed. But it wasn't happening. So finally, I got on the computer myself, and I looked up the MRI results, because I just wanted to know, what's going to happen. If I'm not going to have surgery today, that's fine, but I really wanted to shower. I wanted to wash my hair. So kind of freaked out a little bit figured out I'm not having surgery on Sunday. I do have stones in my common bile duct, so they scheduled me for an ERCP on Monday. I had the ERCP in endo, and it was a failure because my common bile duct was kinked. So they then scheduled me to go into interventional radiology where I had a PTC, correct?
Yes, and just for the folks in the audience, a PTC is an internal external drain, and I understand that the ERCP could not be done because the anatomy was quite challenging, and that was the only way to get the stone out. So.
Yep. So I had the PTC. I woke back up in the recovery room after my second ERCP, and the gastroenterologist said, you know, I didn't see anything. He removed some sludge, and that was it. But when I got back to my room, that's when everything kind of started to go downhill for me. So I started having episodic pain, 10 out of 10. It was horrific. It was very difficult. They called the rapid response team. They gave me, I think, morphine or Dilaudid. I'm not even sure. They thought maybe I had free air in my abdomen. They sent me back down for an acute abdominal series, which came back negative, and sent me back to my room. So this first hospitalization ended up being 11 days. I had a third ERCP because I kept...
And you had a gallbladder removal before that, as I understand.
Oh, that was before my third? Okay, I couldn't quite remember what...
That's okay.
Okay, so the first hospitalization, I had 2 ERCPs because I had a total of 5 by the time all was said and done. Okay, so I get the gallbladder removed. I'm discharged. I went home for 11 days, and you have to remember, I don't go to the doctor. So, like an idiot, I waited 11 days to see my internist for follow-up, and she drew some labs and called me the next day and said, you have to go back to the emergency center, you have high platelets, which I didn't even know what that meant. And guess what? It was Saturday, and I'm thinking, are you kidding me? I'm going back in on a weekend again. So my husband took me back to the emergency center. They admitted me, and I had another, you're gonna have to probably help me with this.
No, that's
so
okay.
I ended up having 3 more ERCPs. I was admitted for 11 more days, so 11, 11, 11.
Right.
The 4th ERCP, by now, my sister is absolutely freaking out and texting me, you know, you need a second opinion, you need a second opinion. So I called my internist, I asked her for a second opinion. She was actually a step ahead of me. She had already brought in a second gastroenterologist who recommended a brushing, a biopsy, and she recommended putting a stent in. So I went down for that procedure, had the stent, and I felt a little bit better, and they sent me home. I still was, even in post-op, the gastro physician still said he didn't see anything. And he felt very confident that it was just inflammation that he was seeing because he had already gone down 5 times. So he sent me home. I still was not feeling good, and I just have never been this sick before. And by now, the wheels are starting to turn. I know something's wrong. Never got a call about my biopsy results, and no news is good news, right? So I only waited 5 days this time before I went back to my internist. So now I'm starting to learn. So I told her I haven't gotten the biopsy results back, and we thought that was a little unusual. So she pulled up her laptop. I was alone. You know, I wasn't expecting to have anything, but, you know, oh, just do this and we'll send you back home. So I was alone. She pulled up her laptop, opened it, and all I really remember is bright red and large words that said abnormal, abnormal, abnormal. And I said, oh, I do have cancer. I kind of knew. I knew something was wrong. So what's kind of odd is I work full-time for Michigan Medicine, and I was an administrative specialist for a department called the Clinical Trials Office. And I had just transferred 2 months. I had just left the Clinical Trials Office, and I had just started working for Precision Health. So I actually had worked with Dr. Sahai. He was on a committee that I would schedule, and I would beg him, like, oh, can you come on this day at this time? And he would always do it.
It was,
So I knew who he was.
and it was a challenging thing to know a person beforehand, and that's the person you're treating. It's a very hard time for us as well, and especially because everybody knew Laurie from day one. So as I understand, Laurie, that you then transferred your care to University of Michigan.
Yes.
And the biopsy results were suspicious for cancer. They were not definitive. And of course, you met our surgeon who immediately recommended that you undergo the Whipple surgery
Yes.
for removal of that. And if I can share the biopsy results,
Absolutely.
and I should have walked the folks through some of the MRCP findings that they identified. And then eventually, that's where the location was. And it was a little bit challenging from a physician's perspective. When you see mass in the pancreas, you are going to start calling it pancreatic cancer. And I think that was where we started was, hey,
Yep.
this must be pancreatic cancer. You've got a mass in the pancreas. And post-Whipple, there was a stricture that only originated in the distal bile duct. And so this was a distal bile duct cancer, not a pancreatic cancer, but that bile duct was traversing through that head of the pancreas. And so this is a very challenging diagnosis that is often wrong and missed. And so I think you underwent the Whipple.
I did.
There were a few
Yep.
complications. And
Yep.
if I can share the pathology
Sure.
results, the pathology results were T3N0, so 22 lymph nodes were taken out, and none of them were positive, and all the margins were negative.
Yep.
I think it was a great surgery, and you took a couple of months to recover from that. There were a few complications, as I said before, and then we met for the first time.
Yep, I started chemo 10 weeks post-op.
Do you have any recollection of the visit that we had, and
You know,
and would you like to share anything?
so it is cliche to say that when you have a cancer diagnosis, when you meet with your doctor, you do smile and nod your head yes. I really can't hear anything that he's saying, but I know that I'm in good hands. And I always take my husband with me now, and he asks the questions, but I really do just nod my head and say yes. And like when I first started the chemo, I thought I had 6 weeks of chemo.
Right.
And I came in and I said, oh, so what happens after June 4th? And he's like, well, what's June 4th? And I'm like, my last chemo treatment. And he's like, who told you that? And I'm like, I don't know. He's like, no, it's 6 months. And I'm like, oh, you're
So
kidding
this is
me.
very true, Laurie, for all patients. And I think after a few minutes of talking with a physician, you stop listening. It just
You
doesn't
can't hear
process. And I think this is very, very big to note that you need caregivers by your side when you go for the appointments. You need that extra set of ears. In fact, 10 minutes after the conversation, you'll start sharing notes and you're on a different page already.
Yep.
And so please ask if your provider would allow recording conversations. Many of my patients do, and I'm very much open to it. And the second pair of ears are always helpful. And so Rob's in the audience, and he was just fantastic and always kept you grounded and,
Yep.
Look at the next step ahead of you than to think, what's going to happen a year from now and so forth. So I gave you my poisons. And
They were tolerable, though. They were very tolerable. I worked full-time the
you're
whole
just
time.
being nice.
No, it was tolerable.
I remember her describing a hand-foot syndrome, which is quite known side effect for folks with capecitabine, and you did not complain to me, but I think you complained to Rob quite a bit.
So I did have hand and foot syndrome. Part of my issue, again, because I don't like to go to the doctor, I just kept saying, well, it's not as bad as the Whipple. So even though my feet were swollen and my skin was dying and they were peeling, I just kept thinking to myself, well, I mean, this isn't as bad as the Whipple. So, but then we finally did disclose it, and he lowered the dose. So I would recommend you always have to report your side effects, no matter how silly you might think that they are, whether it's a fever or swollen feet.
And very, very important to have a free and open discussion with your provider. And if that provider is not having that discussion with you, there's something wrong. need to probably call somebody else. With that, I think you went into surveillance, and
Yes.
we started doing scans and labs and visits every 4
Every 4
months.
months.
And we continued that for up to 2 years.
Two and a half.
2 years from the end of chemotherapy.
Ooh,
Oh,
okay.
sorry. And
I was thinking from surgery.
our surveillance time starts from end of all therapy, so we recommend 5 years of scans at intervals depending on what the pathology was and what is the risk of recurrence. And so based on that, 2 years into surveillance, one of the scans I had to deliver some bad news to Lori. And essentially, we found a nodule that was identified in the peritoneum, which is essentially means the abdominal cavity. And it's very subtle on there, but it was caught on the MRI. And I don't, again, recall if you have any thoughts to share from that meeting, if you remember anything.
So that was complete shock. Post-Whipple, I never thought about cancer. I did not have anxiety that it was coming back. I think it might have been naive of me. We didn't talk about statistics or anything like that. It wasn't coming back, and I was great. We were having our lives. My husband and I took our kids to Alaska. We were hiking. I felt really strong. I actually had commented like, wow, I'm not the weak link that, I thought I was last year, and I felt great. Came home, had the scans, and it was just absolute shock. And then we met, and it was not a good prognosis. And then I really fell into deep despair, anguish, very bad depression. So thankful that my family, my friends, especially my husband, pulls me through that. And so we start, we meet, and you mention a clinical trial.
Yep. So we talked about all the options, right? And that was not a good conversation. And it was very sad and emotional for both of us. Nevertheless, we got through the options, and I don't know how, but you ended up selecting the option for a clinical trial, and I still, for now, don't know why you did that. I don't know if there was something specific about that, or you just wanted to be part of something that would take you beyond standard of care.
So I may not have ever shared this with you, but a couple of weeks before my scans, I had two friends that still worked for the clinical trials office, Kate and Carrie. And Kate and Carrie independently had texted me and said, oh my gosh, I'm sitting in this meeting and there's this great clinical trial and they're having great results and this person is like NED at 52 weeks. And I was like, oh my gosh, that's great, that's crazy. And that's the clinical trial that I ended up on.
So you should not have had that insider data.
Pretend that I did not mention Kate and Carrie. Shh. Schmate and Schmary told me.
So I had no idea about this.
Oops. Oh no.
So we were in the midst of the phase 1 trial, Lori, at that time. We had enrolled 19 patients in the phase 1. We needed 20 patients, and the 20th slot was assigned to another site and was already called for. And that 20th patient, unfortunately, was a screen fail. That means they did not meet all the criteria. So unfortunate for that person, very fortunate for Lori, because we immediately called her up and said, we've got a spot for you. And I don't know if you have anything to share about the trial and the journey and the therapy that you received.
So you have to remember now, this time around, the anxiety is DEFCON 10. Even, like accessing my port, I was just a hot mess. I really was. I was a hot mess. I felt really bad for my chemo nurses because I just wasn't the same like happy, bubbly person. I didn't want anybody talking to me. I just wanted you to get the drugs and get me out of here. And it was a 12-hour day. It was every Monday. It was a very, very long, exhausting day. The side effects from the chemo, again, fatigue, some nausea. I did work full-time still, but I also have a managing director who is so extremely supportive that if I needed to go take a nap, I would take a nap. Or she might see me and say, go home. She just was fantastic. And chemo brain for sure I have this time around. And then I did lose my hair.
Another reason to have another set of ears, it's very hard to multitask and to remember conversations.
Chemo brain, I don't know if I think it is part of the chemo and all the anesthesia, plus probably a dash of menopause. So I cannot get my words out sometimes.
Fair. And then we started, of course, monitoring your scans. And with the first scan, I think there was some ray of hope. The tumor lesion had shrunk already within 2 months by 53%. There were 2 of these lesions. I'm just showing one of them. But there were 2 nodules that were identified in the abdominal cavity. And this was biopsy-proven recurrence. So within 2 months, there was a significant improvement. And I think that brought so much joy to you.
Yes.
I remember you and Rob just completely exhilarated with the knowledge. And I think that was the time where we took your case to the tumor board and said, listen, we've got this young person and we need to do something different. We cannot just fold our hands and say that this is a recurrence and it's outside the area where it started and we cannot do more. It has to be another thing that we can offer. And kudos to Lori, because simultaneously she did her research.
Yes.
It was so funny. We came to a meeting, and Lori's like, I want to take these nodules out, and I want this thing called HIPEC. I just stare at her. I was like, Lori, we already talked about this at the tumor board. It was raising hair on me. I was like, how did you know this? You've really got insider information here.
I have very good friends. I have very good friends.
So the tumor board decided that we are going to take a chance, and because of the exceptional response and the low amount of disease that she has in the young age and good performance status overall, so we, of course, recommended to complete 6 months of chemotherapy to assess the biology of the disease, that it is not very aggressive, and if not the case, we are going to take these nodules out. And I think that made your day.
Yes, that was really what Rob and I had been fighting for, was HIPEC. That was my end goal, was HIPEC. I had learned about HIPEC from 2 different friends, Nancy, who's a dietitian, and then a man named Bob Granata, who was diagnosed with appendiceal cancer and has done great works trying to get awareness out for HIPEC. HIPEC, I felt like that was going to be my best option for longevity. So, I mean, the options were be on chemo for the rest of my life or try to have this HIPEC surgery, which isn't normally for our types of cancer. HIPEC is usually for colon cancer, appendix cancer, and ovarian cancer. So I was kind of a unicorn wanting it. But
lo and behold, I mean, we had 6 months of therapy.
Yep.
There was no evidence of disease. We call it a complete response, 100%. And we took Lori in for surgery.
Yep.
And I mean, she did well, and they found the 2 nodules. They took them out, and she got the HIPEC, which is Lori just talked about, which is heated or hypothermic intraperitoneal chemotherapy, completely unusual and no data for biliary cancer. But that's we just can't look at the guidelines and say that's all we can do. We need to take that extra step. We need to think ahead. So Lori's a case in point, and she's done extremely well after this. In fact, when the pathologist looked at it under the microscope, that's all they could find. So we call it a near complete response. There was only one focus of cancer that they could find in there. So almost complete response, both on scans as well as on pathology.
recovery from HIPEC was much easier than the Whipple, but a true HIPEC would have had organs removed, where I only had the tumors removed. Whereas with the Whipple, like 40% of my pancreas was removed, my gallbladder was already gone, my bile duct was taken, part of my small intestine, part of my stomach. So the HIPEC recovery was much easier. I also walked like a maniac. The second I could get up from that hospital bed, Rob and I were walking laps around the unit. When a new nurse would come in, she would even say, "Oh yeah, we saw you walking, we saw you walking." I just kept walking. I think walking is key, both pre-surgery, if you can, if you're strong enough, and post-op, you gotta walk, even if it's just down the block and back, or just around your house. Walking is very important.
And you've been a warrior throughout, but especially when you went through that phase, you were like, I'm absolutely not looking back. This is it.
It's, again, I have very good friends. My friend Al Rocchini, he's a physician. He had colon cancer in his 40s, and I called him one day just freaking out, and he said, you know what, I just live by the mantra, it's nothing until it's something. And he said, I'm crabby on scan day, but then I'm not giving cancer 1 second of my life until I have to. And I thought, gosh, you know, that is, I'm doing that. And I committed to it, and sure, I have some off days, but for the most part, I am just so blessed that I have a third chance. I mean, you've saved me twice now. Do I think round 3 is going to come? I don't know.
Absolutely not.
And I am not, but I cannot dwell on it until that day comes. And so every time I get a clean scan, I book another trip. Rob is starting to say, like, where are we getting this money from? I'm like, don't worry about it, honey, don't worry about it. It'll come later, don't worry. But every time I get a clean scan, which they're coming up in May.
And there is a lot of scan anxiety.
Yes.
I don't know if you want to talk about that, but I know you look up the results before you come to clinic.
I try not to.
But there's a lot of scan anxiety.
Scan anxiety does definitely exist. I usually do go alone. I'm usually pretty good on scan day, but since the reoccurrence, I think there is more anxiety for me. It used to be, I think when you had a positive result, the test result would not pop into your portal, and now I think they do pop. And that's how I found out I had the reoccurrence. I was getting my hair colored, and it popped, and everything had been great. So I just looked at it, and I was like, what? This is saying I have cancer again. How can this be? I'm getting my hair colored. So
That's an unfortunate
I try
part.
not to, but
We cannot block the results anymore.
I wish
So-
you could.
Right, right. So, yep, all the results are immediately released to our patients. We cannot delay it by a second. And that is, the only results that are delayed are the pathology or the biopsy results that need to be given by the physician. So we are 1 year out,
Yes, 2/28, 2022 is my HIPAC.
and how are you doing now?
I feel great. I feel great. Back to traveling.
You already have your next trip planned after the scan.
Next month, we're actually coming back to Utah, and we're hiking the Zion and the Big Five. But yeah, I think this is important, that cancer has brought many, many blessings along with the bad. You know, Rob and I, there's just no petty arguments. Even when he's yanking the covers off me at 3 o'clock in the morning, because he sleeps like a feral bear. But there's no pettiness, and
you've got a lot of friends, too.
I have a great...
Huge amount of support.
My daughter Caroline says I have a fan club.
Right.
So I do have a fantastic support group, but I couldn't do it. Oh, my neighbor Diane, when I had my reoccurrence, she had these heart LRs made, these signs. I got up right around my birthday, and they were all over my street, all over my neighborhood. It just, my support system, I'm telling you, you can't do it alone. You really do need other people to be there with you, for sure.
Thank you for sharing your story today,
Thanks for
Lori.
having
I
me.
hope everybody's gotten some positive vibes, and you know, we want everybody, of course, to do as well as Lori. And there are folks who are unable to get surgeries and so forth, but I think if you take anything from this, Lori and Rob have been championed. They've done their homework. They've talked to us. They've been very open. We've, of course, shared a very phenomenal relation over the past several years now, initially as colleagues and now as a patient and provider, and now hopefully back to colleagues.
And friends.
And
Hello.
friends.
How soon he forgets.
Well, thank you again, Lori.
Thank you.
Yeah.
Thank you.